Almost 100 million cases recorded worldwide, 2.15 million killed. Here in Ghana, 372 people have been killed as well as of yesterday, with the country recording about 600 cases daily in the past at least few weeks. This is what a tiny virus has done to the world. And with economies crushed, there are calls for another lockdown. But the debate has been, how do countries lock down citizens and still save the economy at the same time? Hello and welcome to PM Express tonight. Let's go through the statistics available to us right now as far as COVID-19 is concerned. Now, first of all, we know that there has been a spike in the cases. We are feeling it right now in our health facilities. So tonight, the question is this, the spike we're seeing in COVID-19 records, a recipe for a lockdown? Let's break down these details for you a little bit. Now, as of 22nd of January this year, which is still in this month, by the way, a couple of days away, about 3 or so, we had recorded 62,135 cases. But that's the bigger picture, by the way. Now, there have been some discharges and recoveries. We wouldn't dwell so much on that. But look at the number of people who have died within this short period of time. We're starting from March last year, 372 so far, but a lot more have died in a shorter period in this particular year. We're looking at 3,613 new cases. That is our active cases as we stand here right now. We have 3,613 people who have been diagnosed with COVID-19. The majority of these cases are from here in the Greater Accra region. And when you take away Greater Accra region, you have the Ashanti region, and then you have the Western region as well. So, as we speak, out of our 16 regions, none of them can boast of not having at least one COVID-19 cases. All of them have recorded, with 243 districts in Ghana reporting cases as well. So it's everywhere. Although Greater Accra, Ashanti region and the Western region are topping, there has also been a sudden increase. Now note this area, because it's a very important part of the entire discussion. In just over 3 weeks, just a little over 3 weeks, or just within that 3 weeks, there has been a sudden increase in our active cases from 800 to 3,000. 800 to 3,000. That's the latest dynamic for you there. And of course, we've given you the areas. If you narrow it down to the Greater Accra region alone, we're looking at areas such as Ayawaso, West Wagon. We're looking at Korle Klote, of course, Osu and its environs. And then we're looking at the Central Business District as well. So if you look at this chart, it gives you a breakdown. Of course, it starts from the top, the biggest region with the biggest number. Greater Accra has been topping since we started recording cases in March last year. If you look at the Ashanti region, we're looking at 444 active cases. But if you look at our 3,000 plus cases, Accra alone has 1,942. It's hitting like 2,000 already. And then you come to Western region, which is, following the Ashanti region with 248. The Eastern region has 76. Central region has 45. Not so bad. But in the Volta region, they're looking at 98, hitting almost 100. Bono East has 14 active cases we're talking about. Western region has 30. Bono has 3. Western North, I beg your pardon, has 30. Bono has 3. The Northern region has 63. The Upper East has 99. Ahafo has 7. Oti has just 2. So Oti seems to be performing pretty well over there. Upper West has 64. And Savannah region 1. Northeast 3. Remember, when we put these regions together, you might have a bigger number because we have broken down our regions from 10 to 16. We'll be wrapping up shortly on the statistics, and then we'll start the conversation. But just take a look at this one. This is just what we see in the Greater Accra region. Now, if you are in any part of these areas, I guess you have to be careful. In fact, we have to be careful wherever we are in this country. But take a look at these sub-districts. If you look at Jowulu alone has 574 cases. Osu, which is not so far away from here, has 251 cases so far. Tenashi has 203 cases, and I'm not very familiar with this area. I didn't even know an area like that existed. We'll get Dr. Patrick Kumar-Boaji to give us a bit more understanding. And then Ablekuma has 182, Legon 181, North Ridge 116, and Teshi North 114, with Kanda having 69. The next must be my final slide. Sutruna is 54. I'm sure if you live there, you know. Ashedu Keteke area 53. Bemi 43. Ni Ashale area 38. Amanfro, Tema South, and it goes on and on. But this gives you an idea, if you live in any of these places, to know what is happening in your region. As I said, let me welcome you once again to tonight's show. My name is Gifty Ando Apia, and tonight we have 4 different perspectives. We have Dr. Patrick Kumar Boaje, who is Director General of the Ghana Health Service. He'll help us understand the figures and actions to be taken from government's perspective. Also, we'll have Dr. Justice Yangsen, who is representing the Ghana Medical Association. He is the General Secretary. He will bring to us the perspective of health workers who are strenuously saving lives from choked facilities. Dr. Yao Bediako is an immunologist and research fellow at the West African Center for Cell Biology of Infectious Pathogens at the University of Ghana. We'll also be talking to him. He will bring to the conversation some understanding to what seems to be slowly creeping in as a new characteristic of the new variant. Also, Professor Peter Quartey is Director of Institute for Statistical, Social and Economic Research. He'll help us appreciate the situation from a purely economic perspective. My name is Gifty Andopia. We'll start PM Express right after this. Just stay with me. You're welcome to the show. This is PM Express. Tonight we're looking at the spike in COVID-19 cases and we're asking, is this a recipe for another lockdown? I have my guest joining me via Zoom right now. Dr. Yao Bediako has already joined us. Doc, thank you very much for your time. Good evening. Professor Peter Quartey as well. Doc, it looks like you are muted. Professor Peter Quartey as well there. Prof, thank you and good evening to you as well.
Well, good evening.
Great.
Good evening to your viewers.
And we also have Dr. Justice Yangsen join us there, right there. Doc, thank you very much. You're welcome. Okay, it looks like you are muted as well. Okay, Prof, I want to start with you. I think that we've had a lot of conversations about the virus itself and its behavior, its character so far. But tonight, the point has always been that the balancing act of saving lives vis-a-vis saving the economy, because after you have been saved, you need to eat. How do you eat when you run down the system that gives you food? So, Doc, I'm just going to start with you. Now, government has warned about the likelihood of a lockdown. The GMA, who are a part of our conversation today, have been calling for a reimposition of the ban on mass gatherings. But help us understand, Prof, how much of a danger is a lockdown at this minute as the economy is?
Well, ideally, a total lockdown would have been good because the virus moves when we move. And therefore, if we really want to bring this down, we need to stop moving. So a total closure or lockdown would have been ideal. But we don't have the resources to contain that. That is the challenge that we are facing as a country. And therefore, some restrictions and also enforcement would have been the second best option. If we lock down, you'll recall that when we did that in March or so, in March, yes, what happened? Our economic activity slowed down. The Ghana Statistical Service business tracker showed that about 85% of 85,000 businesses were closed, and economic activity, sales, and many others slowed down. We saw challenges with employment. Certain sectors were totally or heavily affected: education, financial services, and many others. It even had implications on our fiscal situation. Government will have to spend more in terms of PPEs, in terms of many other health expenditures. Yet, revenue was not flowing as much as would have expected because we were not producing, we were not generating enough income. Then you recall that the vulnerable, the poor, who live basically on subsistence basis, those we call the live according to the description, hand to mouth. These are the ones that if they don't move, they will not eat. And how do we keep them? How do we sustain them? And if you want to keep them indoors for too long, there might be some kind of agitations or uprising or social unrest. So you need to factor all of this in taking a decision. What do we do? As I mentioned, the second option might be to try and restrict certain activities. Like the funerals that we have, there are too many people. These days, it's become too crowded. The markets are too crowded. The shops are too crowded, and even some churches. So perhaps we could look at some restrictions, restricting the numbers, and also enforcing the protocols, the wearing of masks, and many others. I believe making our institutions work would also be very critical, because if you say the police will enforce the laws and yet they cannot, they don't have enough space to even hold people, those that are arrested. I mean, I don't think we have enough cells to even hold them. The sanctions are so punitive, 12,000, up to about 12,000 cedis. I wonder how many people can pay that. So I think we have a situation at hand, and we have to seriously tackle it head on.
And the point has been made that this law itself is unrealistic. Let me bring in Dr. Jansen. We're expecting to join Dr. Patrickuma Boaji as well, so that we can understand the arguments that have been made and what government makes of it, what steps are supposed to be taken. But Justice Jansen, Dr. Justice Jansen himself is also a lawyer. One of the things that have come up, Doc, is that this enforcement is practically impossible. But the Ghana Medical Association is calling for, at least a ban on social gathering. Is it your conviction that, looking at the numbers, that a lockdown would be perhaps better as we sort out the enforcement issues and the subsequent banning on social groupings?
Well, the issues are very simple. Look, if the state wants to enforce, the state can be able to enforce its law. The state always has the power to enforce whatever laws they have. I can agree that looking at our situation where sometimes issues of identity, data, and what have you is sort of really not part of our activity. We are now trying to build a national database and what have you properly. So sometimes a bit of the enforcement could slip through. But by and large, we can do the enforcement to quite an appreciable level. It is just that as a state, we have not decided to do it properly. If you look at somewhere last year when we started enforcing a few bits, people were sent to court. People started complying. So it is just about sending the message and being consistent. But for us, at this point, we believe that the restrictions on these social gatherings should be the first step. Reason is that we have identified them as clear vehicles for the spread. And then once we are grappling with these bits, then of course, in terms of the case count that is rising, if we have actually identified some of these activities as vehicles for the spread of the disease, then clearly the logical thing is to place the brakes on them and then give ourselves some time to organize things properly. Because if you don't put the brakes on them and you keep increasing the numbers, then ultimately the lockdown that everybody seems to be talking about will just be in the offering because you have no other choice. But at this point, if we are able to break the cycle by banning some of these things, then clearly we will have the opportunity to do a mop-up, and then we can see what next will follow.
Okay, but Doc, let me just jump in there a little. I have a two-edged question of sort on the back of what you've just said. So first of all, wouldn't you say that the Ghana Medical Association's call at this point is a bit too mild? And I refer you to this these details here. Bear with me. On 30th March of last year, we had 152 confirmed cases. Only 145 out of that figure were active. Now, 5 people at the time had died, but Ghana went into a lockdown. Let's fast forward to today. Our active cases are inching slowly towards 4,000. 372 Ghanaians have been killed. And what makes this special is that in just about 3 weeks, our active cases have ballooned from 800 to more than 3,600 in just about 3 weeks. So how do you respond to people who say that the Ghana Medical Association, those of you dealing with these cases at the hospital, are asking for something rather too mild, which is why perhaps we haven't had an answer yet?
Well, the issues are very simple. You see, as of last year, COVID was entirely new to the country. We were not prepared in any way. Look, trust me, as of last year, in terms of real places that you could really handle COVID cases, our preparation then at the start was just a 4-bed facility at Bridge Hospital. There was some centralized structure at Tema that had been designated, but in truth, it was not one that you can really say was fit for purpose. We needed a lot of upgrading. In terms of structures, in terms of training, protocols, what have you, most of the things were not in place. So at that time, there was an urgent call for that to happen because we needed to put the brakes on the disease as at then.
Okay.
And if we had done things properly, we could have, at that point, knocked off the disease entirely from our country. Unfortunately, we kept our borders and a few things open for a while, so the case count went up. But by and large, we were still able to manage it. Fast forward, within that almost 1 year period, we've been able to build capacity when it comes to even testing. I'm not saying testing is complete in terms of our capacity, but we have improved. We also have a situation where we have health personnel who have dealt with COVID and have some experience with COVID and now are able to run things slightly more better than at the point where we had not handled any. Some of our facilities, we have somehow upgraded them and are now able to handle, certain caliber of cases as far as COVID is concerned, moderate to severe to even critical. We have built a core team of people who are into contact tracing, who are into risk communication, who are into case management. So in terms of the dynamic, there are some slight differences between what we could do back then and now. If you look at it just on the sheer numbers, then it is going to be problematic. But at this point, we have made that call that all these social gatherings be banned. That does not mean that we will never make a call for a partial lockdown or even a total one if the need arises. Because we need to start from somewhere. We need to start from somewhere.
Well, if you look at the numbers, you say it might be problematic, but the other argument, or those who are calling for lockdown now, have said that the earlier you did that, the better you are at keeping or containing the spread. And the other edge of the question, which I indicated earlier, is that people have asked those who are calling for a lockdown now, that what is the hardcore evidence that social gatherings are to blame for this? They refer us to the registration, the voter registration period. They refer us to political activities last year, and they say once you start talking about banning social mass groupings, then you are looking. They think you're targeting, for example, churches, parties, and people say, well, if we have done registration, etc., we should be able to have our churches, because we can't really see the hardcore evidence linking such groupings to the spread of the virus. Is it?
Okay. Okay. So I get you. The truth is that COVID is not limited to Ghana alone. There is enough evidence from literature. There is enough evidence from practice, even here in Ghana, that shows that mass gatherings are super spreader activities. So there is no doubt about that. Last year, you realized that when we were able to take some of these measures and manage things well, we became the toast of the entire world. Virtually the whole world was praising us for how good we've been able to manage our COVID situation. We banned funerals, we banned marriages, churches couldn't take their usual numbers and all that. Clearly, things were working.
Okay.
Then comes in the easing of restrictions. People took things for granted. So now you have a situation where somebody will go for a party in a mask. They will mask up before they enter the premises. They go in there, they have 1 or 2 drinks. The mask is off now. They want to get some food. People start talking to each other. And then the very things you want to prevent, even though at the entrance they had a mask, once they entered the premises proper, all these things were thrown away. And then the negative effect, i.e. the spread of COVID, then begins to take effect. So we are saying basically that these activities that have been proven as part of our problem, we need to deal with it.
Okay.
And if you listen to the president's last brief or update to the whole nation, and that of the Ministry of Information as well as the Health Service, when the cases are picked up, there is some information that we also elicit. And from all that we had gathered, there was enough empirical evidence to show that a lot of the sick people had picked the disease by and large from such social gatherings.
Okay.
Sometimes you have 10, 20 people who are all in the gathering, all coming up with the disease within the same period. The other bit is that when you put up the restrictions, that's why we don't want to really follow up on just lockdown. Lockdowns are just like one or a subset of the bigger picture when it comes to the restrictions.
Okay.
What these restrictions, i.e. inclusive of lockdown, does is that sometimes it offers you the opportunity to go in and mop up the very bad situation and pick up all the cases out via testing, mass testing, what have you, isolate them, treat them, and then you go back to the community. So it is a multi-pronged approach. It is not just the fact that you have locked down, you go back to sit at home, and then nothing is happening.
Okay.
While you're on lockdown, the health service will have to work actively to ensure that we mop up all the bad cases or all the positive cases in the system and find a way of managing them to reduce the spread. Where we are now, the key thing is we need to slow the rate at which this curve is rising.
It's rising. Okay. And this is a call you've been making the past week, I think. We have Dr. Patrick Kuma Abuaje joining us in now. Dr. Abuaje, Kuma Abuaje, thank you for your time and you're welcome. Let me quickly engage Dr. Bediako briefly and then I'll come to you, Dr. Abuaje. Dr. Bediako, one of my colleagues who is on our health desk was just telling us, I think about last week, how people seem to be recording things or different symptoms that we weren't aware of as symptoms associated with COVID-19. They talk about waist pains, they talk about malarial symptoms, etc. What from your perspective do you see as having accompanied, if you like, this new variant we understand is in Ghana now?
Thank you. I think it should be clear that first of all, when it comes to the new variant, we're still, and I'm sure Dr. Abuaje will say this, we are still confirming whether it is indeed in Ghana. We have isolated it at the airport, and work is ongoing to detect it in the community. But, sequencing requires quite a bit of effort and it takes some time. And also, depending on the prevalence of that particular variant, it'll basically determine how many samples we need to go through before we would detect that variant. So that's the first thing I would say. Given what we found in terms of the variant being present in neighboring countries, I would say there's a high likelihood that it is here, but we are yet to have that evidence. In terms of new symptoms, I really don't think these symptoms are new. Joint pains are typical symptoms of febrile illnesses. So malaria and other febrile illnesses would be associated with joint pains and other things. COVID over time, yes, we saw a shift at some point. People were reporting diarrheal diseases or diarrheal symptoms, as well as the typical flu-like symptoms that people had reported. So COVID can present in many different ways. Whether this shift is due to the new variant remains to be seen, although based on data you can see from like the United Kingdom, from the US, from a number of other European countries, it is quite clear that in those countries, the new variant has been responsible for a spike in cases. So since we are also now seeing a considerable surge, there's good reason to suspect that this might be partly due to this new variant There are three new variants that are typically talked about. One is a Brazilian, one is first identified in South Africa, and the other first identified in the UK. Based on the data we have from the airport, the majority of the new variants that we found were from the UK. But it is important to note that majority of the people had actually not traveled from the UK. So they were traveling from neighboring African countries, but they had the variant that is called the UK variant. It's only called UK variant because that was the first place it was identified. But this particular variant has been shown to be at least maybe 70% more transmissible than the original strain that has been circulating. And if that is indeed in Ghana, then that would potentially explain why we are seeing this increase. Because if it's more transmissible, it means a single person who is infected is likely to infect many more people, 70% more people than the original strain that we had. There's also some evidence that it may be more lethal or it may be more deadly. And actually, there's evidence now being discussed that it actually may be more likely to affect younger people. And that's, if you look at our population structure up until now, it appears we have escaped the worst, partly because we have a very young population compared to European countries or North America. But if this variant indeed affects younger people more, then all of a sudden our advantage is lost. And that may explain. But as I said, we are working very hard at the University of Ghana to sequence, in addition to a few other places around the country. The moment we find this new variant in Ghana, in community samples, it will be announced. But at this point, we are still trying to gather that evidence. Okay,
well, Doctor, luckily for us, we have Dr. Patrick Abuaje, but just briefly do this for me before I go to Dr. Abuaje. With the uncertainties I see or I hear from what you have just said, is this not enough guarantee for us to then say, at least let's go for a partial lockdown?
I personally, my personal belief is that we should be entering certain restrictions. Whether you go straight to a lockdown or not, I think you have to weigh a lot of factors. And as Dr. Yankson said, a lockdown is typically a complete lockdown, like we had early on in the pandemic, is usually for a particular reason. You need to keep people in place to be able to identify where the virus is and swoop in and do something about it. Right now, that worked well when we had a few isolated cases and we didn't have a full-blown pandemic. It appears right now that we have significant community spread. And so a lockdown on its own is not necessarily the only course of action. I fully agree that we need to seriously consider restricting social gatherings. We've made a lot about, is it church? Is it political campaigning? Is it registration? The virus doesn't care why you are in a social gathering. The bottom line is if you are lots of people in a congested place, no matter what you are doing, you are spreading the virus. So I think we need to move the discourse away from, is it a political thing? Is it registration? Is it church? Is it a party? If you are more than 3 meters next to the person next to you, whether you are in a shop or in a banking hall, there is a potential for spread. And so I believe that those, given the way the trajectory is going, I agree with the calls from the Ghana Medical Association. And indeed, and I believe the government themselves have said that those options are on the table. As far as I'm concerned, we are at the point where at least we need to begin to consider restrictions on gatherings. And if it continues, perhaps, a lockdown. But like I said, a lockdown now is different from a lockdown at the beginning of the pandemic where we were just, we had pockets. Right now it's everywhere. So are you locking us down with the virus? Is that going to have as much an effect? You may be able to achieve similar control with restrictions on gatherings, and in this case, enforced restrictions. Because if we have restrictions and we don't enforce them, then we're wasting our time.
Dr. Patrick Abuaje joined us. It looks like the internet hasn't been very favorable and has made us lose him briefly. But whilst we wait to raise him on the phone, let me go to Professor Quartey a little while. Professor Quartey, you talked about the Ghana Statistical Survey that gives us information on just how much we lost in terms of businesses, individual losses, etc. It says that about 85,000 businesses were shut down, but I think about 6 months away from the lockdown, up until by September, their survey findings still show that about 17,000 businesses were still closed at the time. And so there will be dire consequences. But really, what alternatives are there? Do you side with the Ghana Medical Association's position that immediately we should have some restrictions on mass gathering rather than a lockdown?
Exactly, because if you look at what is going on, I mean, you don't have to wait for something different.
Sorry, who am I? Who's speaking now? Okay, it looks like I lost somebody. But that question was meant for Professor Quartey. Professor Quartey, yes.
Yeah, you are very much right. Although 85,000 were closed down, quite a number still continue to remain closed.
Yeah.
But also, they didn't end there. There were about 46.1% of businesses that reduced wages during the period. So, in fact, I can go on and on about the effects on the economy. And I think it's not too good if we should go along that trajectory.
Okay.
So I would very much support the last speaker, Dr. Bediakun, and then previous ones as well, that yes, let's start with restrictions. Let's restrict social gatherings irrespective of the motive. Okay. Let's restrict large gatherings and then enforce the law, because enforcement has been very weak in our part of the world. We have not enforced them at all, and people move everywhere, go to public places without masks on, and so on and so forth.
Prof, let me just jump in there. We've been able to get Dr. Patrick Boaji, who will help us a little bit more with some of the answers that our discussions require. Doc, thank you very much. Did I just lose him again? It looks like I did. Well, that's Dr. Patrick Boaji, the Director General of the Ghana Health Service. We're trying to, now what I'm hoping to get from him is, you know, how these concerns that have been raised by the GMA and by Dr. Bediakun, who has just spoken, and indeed corroborated by Professor Quartey, feeds into what next steps government will take. Hopefully we'll be able to reach Dr. Boaji once again. We lost him on Zoom. We've lost him like twice already on the phone. But let's take this quick break. When we return, we'll try and raise him back. You're welcome back. This is PM Express. My name is Gifty Andopia. We're talking about the coronavirus spike in active cases, and we're asking, is this a recipe for a lockdown? My guests so far say they do not think so. They think some level of restriction will help. Well, let's... Dr. Boaji, are you there with us? Dr. Patrick Boaji is the Director General of Ghana Health Service. Looks like we lost him again. I'm not quite sure who else I have. I do have Dr. Bediakun, who is an immunologist. I have Dr. Justice Yangson, who is the Ghana Medical Association's General Secretary. And I do have Professor Peter Quartey, Director of ACE, all of them here on the show. Now, the person we haven't heard from yet is the Director General of the Ghana Health Service, who we keep losing on the line. We're fixing that line to raise him back to have that conversation. So, Dr. Justice Yangson, I just want to come to you with this. Your call has been pending for a while. I think you started this call somewhere last week. Have you taken it directly to the doorsteps of the people making the decisions, or has it just been a call you've made in the media, and why?
Well, all our engagements are always formalized. So whatever we put out, we have also sent in or discussed it with, in quotes, the powers that be. Okay. We are not completely out of the picture in terms of how things are being done. But of course, we also have a certain responsibility that we need to discharge towards the general population, inclusive of doctors themselves. and we need to guide the process. So we make sure we interact with the ultimate decision makers, we interact amongst ourselves, and then we interact with the general community through the media. Sometimes we even have one-on-one engagements, depending on what the situation is, with other stakeholders within the whole structure. So we've had collaborations with, say, the NCC. We've been to various places to do education and what have you. So whatever we do, we try to rope in everybody. And we've had quite a lot of discussions with the principal state actors as well.
So did you get any assurances, any timelines, perhaps?
Well, the difficulty with some of these things is that, you hold meetings, you send petition papers, what have you. But because there is an ultimate decision maker who also goes through some processes and probably listen to other advisors, it is very difficult to say that at all times you can get results the very best.
Dr. Youngson, let me just jump in. Sorry, let me just interrupt you briefly because I have Dr. Patrick Kumar Boaji right now and I don't want to lose him again. Doc, thank you and good evening. Dr. Boaji, it looks like you are muted. Okay, he's on phone actually. Doc, good evening. Thank you for your time. So first of all, let's start with the Ghana Medical Association's call, which right now on this show, the two other panelists. Hello, Doc.
Good evening.
Right. So I'm talking about the Ghana Medical Association's call for reimposition of restrictions on social gathering, looking at the speed at which we're recording new cases and people dying. The two other panelists we have on this show are all supporting that call. The GMA has made that call for like a week now. What is the Ghana Health Services position?
Hello.
Hello, Dr. Boaji.
Yes, good evening. I'm sorry for my inability to join early and having some network challenge.
That's all right. That's all right. The GMA's call. How is the Ghana Health Service responding? How soon?
Well, I think these are things that we continue to consider all the time. Of course, the imposition of restrictions is done by the executive. We also make recommendations, just like GMA has made. And we believe that, as we have said all along, some of these restrictions are very, very helpful in reducing the spread of the virus and actually curtailing the state.
So sorry to jump in, Doc. I know it's early in your submission yet, but you indicated that you make your recommendations. Have you recommended this to the authorities? I mean, the authorities that will ultimately take the decision that we ought to restrict mass gatherings. And the GMA said they wanted us to start with the funeral of the former President, Jerry John Rawlings.
Well, we haven't made such recommendation, but mind you, under the current system, there are some restrictions even on funerals and mass gatherings. What we probably need more is enforcement and compliance by the people. Funerals are not supposed to be as open as should be. Clubs are closed, are not supposed to be opened. Even where there are numbers and the duration that depends how long these things can last for. I believe these are restrictions that we can enforce and ensure that maybe we may be able to tighten a bit more, not necessarily across the country, but we have to study the pattern and see where do we really, and what gives us the best option. Because like I'm saying, we are saying this is just not just lockdown or restriction, also has its own effect. It has to come up with a good balance, and that's why we make the health recommendations, and then the executive will have to look at all the other ramifications and come up with a hybrid that saves the country. But yes, we believe that it's time to have some restrictions, and most importantly, compliance with existing restrictions, and that will help us. Mask wearing will be very, very helpful, and we've done it before. And so I believe that these are things that we can go back to.
Did you say the authorities are studying the trend? Hello, Doc.
Yes, I can hear you.
Yeah, did you say that you haven't yet made that recommendation, but then the authorities are studying the trend? I just want to be clear that that's what you said.
No. What I'm saying is that currently there are restrictions.
No, that part I heard. That
Yes.
part I heard. But you didn't say that authorities are studying the trend.
No. Say that even within the restrictions, as we make restrictions, we can continue studying the trend, see whether further restrictions are necessary or some restrictions are not very useful. So it's a dynamic situation. That's what I'm talking about.
Okay. This is a question that I put to the GMA. I just reproduce it for you. By 30th of March last year, we had just 152 confirmed cases in all. Out of that, 145 were active. Just 5 people, unfortunately, by the way, had died at the time. As we speak, in just about 3 weeks, we have seen our figures moving from 800 to over, now getting to about 4,000. And those who are calling for lockdown are saying, what in the world are we waiting for? So even the GMA's call for restrictions are pretty mild compared to those who say we must go on a lockdown now to deal with it and open up again.
Yeah, the lockdown helped us understand the disease better. They help us to learn more about what the situation is. And I'm sure you remember that at the time we were easing restrictions, the numbers were higher than when we started. And so you get to learn about what are the best ways to control the condition. It may not necessarily be a full lockdown, but there are certain essential restrictions that can still do the job without necessarily doing the lockdown. The lockdown and the initiatives allowed us to do our risk assessment, establish whether there's a community spread, and many other things that we learned, which we have used in managing the system up to now. And so it is not so much of the numbers, but like I keep saying, by the time we're removing the restrictions, the numbers have not gone down. They have actually gone up a bit. So it's not. So we shouldn't say that because we have active case of 3,800 past now, and so that's a recipe for lockdown.
It is not?
It's recipe for restriction. And I'm sure you have seen that other parts of the world are doing restrictions and other systems that is not controlling without necessarily have to go through a full lockdown.
So it looks as if we're not really sure. I mean, at least at the Ghana Health Service level, we're not really sure what we want to do, whether it's restrictions or a lockdown.
I think I just say that it's restrictions.
Restrictions. Is that something you are considering, or is that something you believe is the ideal, but it's not yet on the table?
A lockdown is a package of restrictions. Okay. And so we can still do some lockdown, some restrictions, to still achieving the same result. It doesn't necessarily mean that you have to do the whole lockdown. Mind you, we did a partial lockdown, and so the more communities were open because of our infrastructure challenges, people going for water, going for food, etc. And so we have worked with other restrictions that has gone down quite well. I think GMA has made these recommendations. We are also studying it. We have our own recommendations which we have made, and we will look at it and see. I'm sure the executive will take the right decisions that will help us control. But the current protocols, I mean, you see, if we have basic protocols like wearing of masks, social distancing, and we are refusing to obey them, and then we go on to go and do a lockdown, we only open and go back to the same issues again. So there are certain basic things like the use of masks, social distancing, hand washing, which will be very, these are public health measures that will be very helpful. That I think we must also ensure that we also put them to the full hall before we really move to.
Let me just bring in Dr. Dr. Youngson on this, seeing the Ghana Health Services response to the calls that you have made. Dr. Youngson, is this satisfactory? Is this good enough? Or is this, as some people have accused the Ghana Health Service of being a bit too laid back for a time like this?
Well, I think that by and large, the Director General is saying that, look, we need to do some restrictions. Maybe the only point at which we may differ is maybe the extent to which those restrictions will have to be carried out. And like he rightly said, lockdowns themselves, and I think I've also said it earlier, are part of restrictions. What we are calling for are enhanced restrictions on these social gatherings, social activities that are creating a clear problem for us. And I think on that basis, we all agree that this is a problem.
But that was your call.
And do it quickly. Except to say that I think the Director General was trying to say that, well, those recommendations have been made, but the ultimate decision making has to go through some processes, or it doesn't really lie with him.
Yes, he said that, but he also said that that recommendation, and he's here to clarify if I got it wrong. He's indicated that that recommendation has not been made to the authority that will, call for that lockdown. But Doc, your call, the GMA's call was very urgent. You wanted urgent response, but does it not bother you that hasn't come within the period we've been having this discussion?
Well, you see, the truth is that we have made our call, and we expect that there should be some urgent, response. But of course, because it also goes through processes, we cannot say that the moment we made the call, within the next 1-2 minutes, the decision should be made.
Right.
But the longer we wait, the worse, from our perspective, we are going to get as a people.
Okay.
We need to take the steps now, break the current trend, and make sure that at least we put the brake on the spread and try our best as a people to contain the situation. No, we are calling for this not just necessarily because of the numbers, but bearing in mind that, one, we have a very fragile health system. It is not robust enough in terms of even facilities to manage severe to critical cases. It is roughly skewed towards Accra and slightly Kumasi. But even those two are still not in a good situation.
Okay.
The other regions don't have a lot of capacity compared to Accra. But now that we have all 16 regions reporting cases at a clinical end, we are seeing a lot more severe, critically ill patients. What it means is that a lot more people, sooner than later, will not have access to health care, especially when it has to do with high dependency units and specialized units, ICU, what have you. Okay. And then once they are not getting access, the mortalities are going to go up. Sometimes you may get access, but there are going to be a lot of delays because they are queued. And before you get in, the complications that we are all trying to resolve would have worsened.
Okay.
So we are looking at the ultimate in terms of the clinical picture, the management of the cases, the resources we have, and the state of our health system as well.
Okay.
And that is the more reason we believe that we need to act early to break the chain of transmission now. Because now what is happening is that there's an exponential growth that is happening in the system. And if we don't put the brakes there,
it will spread further.
We'll be overwhelmed.
Right. Dr. Bediako, let me just take your final words, and then I'll give the very final word to Dr. Kumar Boaji. Dr. Bediako, you also wanted the restrictions, but from the Ghana Health Services response that we have, it is not something that's going to happen at least anytime soon, unless something rather drastic happens. Make that brief for me, if you may.
Oh, that's not what I got from Dr. Boaji's submission. I think I agree with Dr. Yankson that Dr. Boaji basically agrees with us, but he also he does not make the final decision. So I think now it goes beyond the Ghana Health Service. I think now the call needs to be, the response needs to come from the government.
Okay. Doc, I just have to...
I think it's safe to say that all the experts, whether it's the scientific community whom I represent, the medical community who Dr. Jackson represents, the Ghana Health Service who Dr. Boaji represents, saying we all are speaking pretty much the same language, saying that this is a serious situation. If we don't do something, it's going to get really, really bad.
Okay.
And so the least we can do is impose restrictions that we have imposed before and see what happens. If we need to do more, then we do more. But at least as a start, let's restrict social gatherings. Let's restrict funerals, weddings, other gatherings of that nature. and try to get a handle on this outbreak.
I say a very big thanks to you, but Dr. Patrick Kumabwaje, I'll give you the very final word. We still have a funeral ongoing, by the way, a national funeral, by the way. Your final words, if you can do that in 30 seconds for me, I'll appreciate it.
Yeah, thank you very much. I think our position has not been that no restrictions. Instead, I was saying that, yes, restrictions will be necessary, but there are current restrictions that we are not abiding by, and that we must also enforce and see whether further restrictions will be important. The application of the protocols. Now, I've seen people wearing the mask now. If that continues, that will also curtail the spread of the virus. And so we need to do a combination, not jump from one to another, but also let's make sure that we abide by the protocols, and if there are any enforced current restrictions, and ensure that if there are any, we'll move more.
Doc, thank you so much for your time. I've had Dr. Yankson, Justice Yankson, who is the General Secretary of the Ghana Medical Association, Dr. Bediako, an immunologist at the University of Ghana, and of course we had Professor Peter Quartey, who is with ISE, an economist, bringing us that perspective as well. My name is Gifty Ando Apia. I say many thanks for your time. Do have a good evening, and we'll see you tomorrow.